Thanks for being here this morning. Wow, what a great group, which is appropriate because we have a great program planned for you today. Welcome, my name is Holly Brenner. I'm fortunate to serve as the Vice President of Strategic Development and Marketing for our system. I'm glad to be here and I'm grateful that you're here as well. We are going to do things in a little bit different order this morning. We do have a reflection for you, but I'm going to introduce our provider here today that will be leading our presentation, because the reflection is a video, and it was a video that was created by a Leadership Fond du Lac class. Any of those members in the room today? Yay, thank you for your work. This is especially a neat project. Anna Van Buren is an associate here at Agnesian, and it's part of the reason that this is part of our program today. And I think once we play it, you'll understand the relevance and the connection here, so I won't go into that. But leading our presentation today, we have Dr. Mary Kirkwood. Dr. Kirkwood is a psychiatrist here with Agnesian HealthCare, and she's been part of our system for 10 years. She received her training at the Medical College of Wisconsin in Milwaukee. She's also board certified in addiction medicine, and she works with people on their opioid addiction. So please join me in welcoming her. On the table in front of you, as I always do, there are just a few pieces of things I'd like to draw your attention to. Our presentation next month is Dr. Schaefer. Dr. Schaefer will be here talking about plastic surgery and cosmetic services. And of course, you're familiar with these sheets, the yellow comment cards. Please continue to fill out those and give us your feedback, because we do make adjustments based on what you tell us. And if you're interested in winning a chance to win our door prize, which looks like an activity bag or a duffel, no one go duffel, please fill out this green sheet and we'll pick that up later on. So, Colleen, could you cue up the video, please?
My brother, Tyler Haas, passed away from a heroin overdose Thanksgiving morning 2011. Obviously, it's one of the most difficult things I've ever been through.
Using prescription drugs prior to heroin use is a common phase, you could say, into, I guess you'd call, graduating to heroin. At least half of the heroin users that I've dealt with in my line of work started off using prescription medication. There's no one typical type of person that uses heroin or prescription pills. It's not a male problem prior to heroin use. White problem, black problem, it's across the board a problem.
I mean, I had a great life growing up. You know, I have amazing parents. I can ask for better parents. I was a good kid. I ended up getting mixed up with the wrong crowd. I started doing heroin, and it totally turned my life upside down.
I knew Kelly was using. Her attitude changed from being a real nice person to just kind of a bitter, get away from me and I'm going to leave the house and see you later.
When she'd come home, sometimes her eyes would look different and she would act different. She started trying to avoid the family more so than the average teenager is. She had saved up a substantial amount of money to go on to school, and that started going downhill fairly quickly.
Typical opiate use, a lot of times you see people that lose weight because their need for the drug becomes their sole driving purpose in life. Heroin and prescription medications have a psychological and physical dependency. So if you don't get that drug, it becomes very difficult to function. A lot of times people who have addiction, especially to heroin, we see, it's very embarrassing for them because there's such a dirty stigma with heroin use. The stigma with prescription medications is that they aren't dangerous in our society. You can find the prescription opioid pills like Percocets, Oxycontins. Pretty much any house in the city is going to have that in them because they're prescribed so much for injuries. So it's a dangerous gateway into heroin that I think a lot of young people don't even realize. Somebody who's addicted to prescription medication, they build their tolerance and the prescription pills become too expensive for them to maintain their habit.
Addiction is a chronic disease. Just like diabetes or hypertension, it works in that same way. So it's with you for the long haul. If they say no, they're not ready for treatment, just let them know that you're there for them and that when they're ready, that you'd be there to help them with whatever they need. Certain treatment options come like with a medical assisted type of a program. It would be a little bit easier for that person to maybe think of quitting because it wouldn't be quitting cold turkey.
If you're struggling with addiction, it's just that you got to talk about it. If you don't want help, it is very, very, very difficult. I encourage everyone to talk about it as much as they can and get as much help as you possibly can.
I ended up seeking help because I got arrested. While I was incarcerated, I found out I was pregnant. I just realized I can't do this lifestyle anymore. It's not just me. I have to take care of someone else. I go to treatment weekly, I go to groups, I go to NA twice a week. And I just surround myself with good people and good influences.
My advice for other parents in the same situation would be to don't give up. When they do finally say, yeah, I need some help, or whatever it comes down to, give them a lot of love and support. Don't shun them away. Just, they need you. They need you a lot.
Just noticing the signs and symptoms and paying attention to the little things, that makes all the difference in the world.
Just don't give up hope. There is another way of life.
Can everyone hear me? You guys hear me in the back? Okay, so today I'm going to be giving you an overview of pain pill and heroin addiction. We're going to talk about how these drugs affect the body, as well as how these drugs negatively affect people's lives. We'll also talk a little bit about how and why people are dying of these drugs. And most importantly, we will talk about how we can help those who are addicted. So what are opioids? Opioids are medications and substances that bind to the new opioid receptor in the brain. Now when this happens, people experience less pain, but they can also experience sedation, euphoria, nausea, and impaired decision making. Too much opioid can cause a person to stop breathing and die. Examples of opioids include hydrocodone, which is Vicodin, oxycodone, which is in Percocet, morphine, codeine, fentanyl, and heroin. There are actually 11 symptoms that characterize opioid addiction, and actually any addiction for that matter. Now some patients have only a few symptoms, and some have most or all of them. I would say most of the patients that I see in my practice have most or all of the symptoms. Now rather than listing all 11, I've lumped some of them together to make it a little easier to take in. One symptom is tolerance and withdrawal. Now tolerance is when more opioid is needed to get the same effect. Now people are pretty familiar with this with regard to alcohol. Someone might get a buzz from 2 drinks, but a few months later, if they drink on a regular basis, it might take 3 drinks to give them a buzz. And the same thing happens with opioids. Now withdrawal, that's when a person who takes opioids regularly gets a typical set of symptoms when they don't have opioids. The most common withdrawal symptoms are body aches, fatigue, nausea and vomiting, cramping and diarrhea, hot cold sweats, and anxiety. Now other symptoms of opioid addiction include the inability to cut down or control use. People who are addicted often spend the majority of their time trying to get opioids or recover from the effects of opioids. Yes? Okay. How's that? People who are addicted often have strong cravings to use opioids. They also don't take care of their responsibilities at work, school, or home. They may also use opioids in dangerous situations, like with driving. As I said, there are 11 symptoms of opioid addiction, and we generally characterize someone's addiction based on how many symptoms they have. That with a mild severity would be 2 to 3 symptoms, moderate would be 4 to 5, and severe would be 6 or more. Now, although someone can be diagnosed with just 2 symptoms, If it's just tolerance and withdrawal, an addiction would not be diagnosed if a person is taking their medicine as prescribed under a doctor's care. That's because anyone who is treated for pain on a chronic basis with opioids will develop a tolerance over time. And if they stop their opioids, they will experience withdrawal as well. But those two symptoms alone would not be enough to say that they have an addiction that requires treatment. However, because the risk of addiction is so high with chronic opioid use, the Center for Disease Control recently recommended that doctors not prescribe opioids for chronic pain. Opioid painkillers cause more deaths than any other medicine for non-fatal conditions, 40 deaths per day in the United States. So how do people get started along the path of addiction? Many of the patients we see have had multiple or complicated surgeries, or they are started on opioids for chronic pain. Others we see are offered pain pills at parties to get high. After using the pills on a chronic basis, patients get sick from withdrawal when they don't have pills. Usually they are so sick they can't function at work or take care of their families, so they look for pain pills wherever they can get them. Now, the withdrawal symptoms I talked about last anywhere from 7 to 14 days, depending on the type of opioid that the person is using. Now, some people might say, well, if that person can just get through those 7 to 14 days, then they'd be okay. And I've seen patients do just that. They lay in bed for days, they're very sick, they can hardly get out of bed. And then when they finally get through that and start feeling better, they relapse anyway. Now, that's partly because of something called post-acute withdrawal. The post-acute withdrawal can last up to 2 years, and it includes symptoms of irritability, anxiety, tiredness, trouble concentrating, and disturbed sleep. So again, patients feel compelled to get opioids to relieve those symptoms. As many of you have heard, we are seeing more and more heroin use in our community. Now, most of these patients started with an addiction to pain pills. However, as addiction to pain pills has become more prevalent, the government has cracked down on the number of opioids that doctors can prescribe for patients. So now pain pills are very hard to find and they're very expensive to buy. Heroin has the same effect because it's an opioid, but it's cheaper and easier to find. So when patients start going through withdrawal, sometimes heroin is the only thing that's available. So what can we do to help people who are addicted to pain pills and heroin? Medication, counseling, and family support are very important, and I'm going to talk a little bit about each of these. There are 3 medicines that are FDA approved for opioid addiction. 2 of them are opioid replacement medications, which means we give patients an opioid specifically designed to treat addiction to help control the withdrawal and cravings. The 2 medicines are Suboxone and Methadone. The other medication is naltrexone, which is not an opioid. This medicine helps with cravings, but not withdrawal, because it's not an actual opioid. And although the naltrexone is helpful for some patients, it is thought to have a lower success rate than Suboxone and Methadone, although there have been no studies comparing them directly. So what is the difference between Suboxone and Methadone? Both eliminate withdrawal and both control cravings. Now, one benefit of Suboxone is that patients rarely develop a tolerance. Usually once we settle on a certain dose early in treatment, their dose rarely has to be increased. With Methadone, patients often require escalating doses over time. Now, another benefit of Suboxone is that it can be prescribed 30 days at a time, whereas Methadone requires patients to go to a special clinic every day to get their dose. Now, this can be an inconvenience for some people, although the closer monitoring does benefit some patients who are having a harder time staying clean. Now, which medicine works best? As far as which works best, both Suboxone and Methadone are equally effective in decreasing the risk of relapse. But Methadone has a slightly higher retention rate. That means fewer people on Methadone drop out of treatment. Now, I'm not aware of any studies comparing relapse rates between Suboxone and Methadone versus naltrexone, but one thing we do know is that more people drop out of treatment who are on naltrexone versus the other 2 medications. We think this is because naltrexone doesn't control the withdrawal and cravings as well because it's not an opioid. Plus, naltrexone can only be given 10 to 14 days after a person's last dose of an opioid. Otherwise, the naltrexone can increase a person's withdrawal symptoms. Now, which is safest? Between Suboxone and methadone, most studies have shown that Suboxone is safer. This is for two main reasons. One, methadone has a 4 times greater risk of lethal overdose. Two, Suboxone contains both the opioid buprenorphine, which is what controls the withdrawal and cravings, but it also contains naloxone, which blocks the effect of the buprenorphine if it's injected. So there is a lower risk of patients trying to inject Suboxone into their vein. Now, naltrexone is truly the safest of all because it's not an opioid, so there's no risk of overdose. But because it doesn't control withdrawal and cravings as well, more people drop out of treatment who take it. Now, I've talked quite a bit about medication, but we know that medication alone is not enough to treat opioid addiction or any addiction. Studies have shown that counseling plus medication is more effective in treating addiction versus either one alone. We need to help these patients learn how to cope in everyday life without drugs and to make lifestyle changes to help them stay clean. It's also important to educate families about the importance of treatment and how they can best support their loved one with addiction. Now, opioid addiction can affect anyone, even those who are pregnant. Many expectant mothers come to us concerned about their opioid use and wanting to get healthy for their babies. And there is no question that the most recommended form of treatment for pregnant patients is with either Suboxone or methadone. If a pregnant woman tries to get off opioids completely while she's pregnant, the risk of miscarriage is very high. Plus, she is far less likely to stay clean, which decreases the chances of her providing a good home for her baby and attending prenatal visits during the pregnancy. Now, there is a risk that the baby will suffer withdrawal from opioids after delivery if the mom is on Suboxone or methadone. I've had a number of pregnant patients on Suboxone. Some babies have no withdrawal at all. Others have had to stay in the hospital a few extra days. One baby I know of had to remain in the hospital for a month due to withdrawal symptoms. However, even with that risk, women and their babies have the best outcome if they take either Suboxone or methadone. It seems like a day doesn't go by that we don't hear about someone who has suffered the consequences of opioid addiction. Now more than ever, we are hearing about people dying from opioid abuse. Even in Fond du Lac, the number of deaths by suspected overdose are increasing at an alarming rate. We started seeing deaths by opioid overdose in 2012, and that number increased to 12 deaths in Fond du Lac in 2015. People die from opioid overdoses because too much opioid decreases a person's drive to breathe, so much so they stop breathing and die. And deaths by overdose, mostly due to opioids, has now surpassed deaths by car accidents as the #1 cause of accidental death in the US. And actually 29,000 deaths in 2014 were attributed to opioids alone. Now this slide shows a couple quick facts about how much opioid deaths are increasing. The number of opioid deaths tripled between 1999 and 2013. Now between 2010 and 2013, the number of deaths due to opioid pills stabilized, but the deaths by heroin increased by 37% per year. So which people die when they take too many pills or too much heroin? Of course, anyone can die if they take too much, but there are some factors that increase a person's risk of dying. One is when people combine opioids with either sedatives or alcohol. Sedatives would be sleeping pills like Ambien or anxiety medications like Xanax or Valium. Another risk factor is when people use illegal opioids, especially heroin. Because illegal opioids are not regulated, they have different potencies and purities. So if someone knows they can tolerate a certain amount of heroin, and yet they buy from a supply that's more pure than usual, that same amount may end up killing them. Also, people who recently got clean or who were forced to get clean have an increased risk of overdose death. Let's say someone goes to jail on a drug-related charge. They're there for a few months, they get out and relapse. They think they can use the same amount of opioid they did before they went to jail, but because their tolerance has dropped, that same amount ends up killing them. And actually 4 of the 12 deaths in Fond du Lac in 2015 were due to those who were recently incarcerated. Finally, people with lung disease or sleep apnea are also at a high risk of dying of an overdose. Many of you have probably heard of Narcan, which is a medicine that rapidly reverses the effects of an opioid overdose. It comes as both a shot and a nasal spray and can be given by people in the community when an overdose is suspected. Communities that distribute Narcan have lower rates of death by opioid overdose. Now, it may not always be easy to recognize the victim of an opioid overdose. If the person has a drug history and they are non-responsive, not breathing, have a blue color to their lips or fingers, and have small pupils, it could be that it's an opioid overdose that you're dealing with. But even if you give Narcan and the person wakes up, that person may not be out of the woods. If the person overdosed on a long-acting opioid like methadone, Narcan may block the methadone for a period of time, but then when the Narcan wears off, the person may become unresponsive again and need another dose. So even if the person wakes up, it's critical to call 911 or get that person to an emergency room for further care. Now, the people that can benefit from a Narcan prescription include anyone diagnosed with an opioid addiction, anyone in treatment for an opioid addiction or who recently stopped treatment, and anyone at risk of decreased tolerance, like those recently released from jail. It's also helpful for any friends or family of opioid-addicted patients to have Narcan available. Now, thankfully, Narcan's available by prescription at most pharmacies. Agnesian pharmacies have it available as well, and they hope to have it available over the counter soon. Now, opioid addiction is a national problem, not just a local one. President Obama recently participated in a summit to figure out ways to help those who are addicted. Some good things came out of that summit. Suboxone doctors will soon be able to increase the number of patients they treat from 100 to 200. There will also be an increase in funding to help those who are addicted. Money will be directed at underserved communities with poor access to treatment, and also to programs to help increase the distribution of Narcan. Money will also be utilized to provide clean syringes to IV drug users to decrease the risk of HIV and hepatitis. Some other things that are being done at the national level: Medicare, Medicaid, and marketplace insurance plans will be required to offer more access to opioid treatment. The Center for Disease Control has issued guidelines to help primary care doctors prescribe opioids in the safest way possible. Also, the FDA announced a black box warning for the fast-acting opioids, warning about the risk of abuse, addiction, and overdose death. They are also developing generic versions of opioids that cannot be crushed to decrease the risk of people snorting or injecting them. So that's a little bit about what's going on at the national level. And now we'll talk a little bit about what St. Agnes has to offer people who are addicted. Anyone who has concerns about their use of opioids can call our outpatient clinic for an addiction assessment by one of our addiction counselors. Now, most of these patients are referred to our day treatment program. This lasts from 2 to 5 days from 8 a.m. to 4 p.m. During day treatment, most patients are started on Suboxone, while they also attend groups aimed at education about addiction and the development of coping skills. After day treatment, patients participate in individual and group counseling on an outpatient basis and see a psychiatrist for the Suboxone. We encourage all of our patients to attend Narcotics Anonymous as well. Studies have shown that patients who attend NA at least once a week have lower relapse rates. Now, patients may stay on Suboxone for a year or two or even longer. As long as the patient is doing well in treatment, they're going to work, staying out of legal trouble, taking care of their families, and following treatment recommendations, Suboxone is available to patients at St. Agnes for as long as they need it. For those patients who opt not to take Suboxone or who are successfully weaned from Suboxone, we encourage them to continue NA and individual counseling as well. We also offer treatment with naltrexone for those who are interested, and we also provide evaluation and treatment of depression, anxiety, and other emotional health concerns. Now, for those individuals who are looking for treatment outside of St. Agnes, I've included some websites here that provide access to other facilities and programs that provide both Suboxone and methadone. To summarize, there probably isn't a person here who hasn't been touched by opioid addiction in some way. Whether it's a patient they worked with, a family or friend that they know, or concerns about their own use of opioids. I hope the information I've presented has increased your awareness about the dangers of opioid addiction and how hard it is for those addicted to opioids to quit using them. In spite of this, though, there is help. And whether it's here at St. Agnes or some other program, I hope those who are struggling can take that first step and call for an evaluation. So that concludes my portion of the talk. Now I would like to introduce two young women who have struggled with opioid addiction, but who have been very successful in treatment. They're going to tell you a little bit about what they've been through and how far they've come. This is Wendy and Kelly, and we're going to start with Kelly.
So my name's Kelly. I am a recovering addict, and this is my story. Growing up, I had a really good childhood, amazing family, good parents, just, a good life. They were very loving and supportive. I went to a Christian day school. I got very good grades. I was active in sports. I had friends and everything. And I was in that school till 8th grade. And after that, the girl I was really good friends with went to a different high school than I did. So when I entered high school, I kind of just started making all new friends. And I never really felt completely accepted. So the group, I guess, I felt the most comfortable with were people who used. And it wasn't an everyday thing. I just started smoking weed, drinking on the weekends, that kind of thing. And eventually it increased. I met new people, parties, I started trying new things. And then probably about my junior year in high school was the first time I ever tried opiates. And again, it didn't start out, I didn't start out shooting up heroin. I just did it, once in a while, once a week. Gradually it increased to once or twice a week. And by the time I graduated, I was using pills every day. However, I was able to maintain good grades. I graduated on the high honors every year. And I didn't really feel like it affected my life that much, I guess. I just kind of felt like, well, it's what I do. It's not that big of a deal at that point. And then after I graduated, I noticed how my desire to use kept increasing. When I would go pick up, I would notice how I had to go more often. It wouldn't last as long. But again, I didn't really understand anything about addiction. I didn't think I was an addict. I thought it was normal. Like, the people I hung around with, like, that's what we did. It was just part of my life. But as it went on, I got harder and harder. Like, it was impossible to save money. And it just kept getting worse. When I was 19, I got in a car accident and broke my neck and my back. And I was prescribed pain pills. Like I said, I was using every day before that, but that incident greatly increased my use because I had access to them, better access to them. And eventually, my employment began to suffer. I would lose jobs because of it, because I couldn't go to work because I was sick, but I needed to go to work to get money so I could feel better, and it was just not a good, it was a bad cycle. So when I was 20, was the first time I was introduced to heroin. A friend of mine came over because I was sick, and heroin was the one that I was like, oh, I'll never do that. I'm not that bad. I'm not like those people. But at that point in my addiction, I just gave up. I was like, you know what, I don't care. If it's gonna make me feel better, fine. And I realized how much cheaper it was so much easier to obtain. And I felt, well, as long as I'm not shooting up, I'm not, it's not that bad. I'm not, like a junkie or anything. And I just kept trying to justify it in my head. but as soon as I tried it, it escalated very, very quickly. It wasn't long before someone convinced me that I might as well start shooting it up because I was wasting it. I thought, oh yeah, you know, I'll use less then. I won't have to do as much. It'll help me save money and whatever. It was, yeah, a very, very bad decision on my part. And then probably about 4 or 5 months after I first started using heroin, my parents found out and basically said either you need to get help or we're calling the cops on you. So I obviously chose to get help, and I was clean for about 6 months. I got involved in NA, and I was doing okay. I also had legal issues. I had a theft charge, and I got probation for that. You know, things are going okay. And late December of 2013, a very close friend of mine passed away, and I made it through his death clean. However, at the funeral, I got in contact with old using friends, people who are still using, and I thought, hey, you know, I have so much clean time, I'll be okay. I can hang out with them, you know, as long as they don't use in front of me, I'll be fine. And I was for like a week or two. But eventually it led to me thinking, well, alcohol wasn't my drug of choice, so I can do that. I'll be fine. And within a week or so, I was right back to my drug of choice. And I picked up right where I left off, and it only got worse. It got worse very quickly. So in February was when I relapsed, February 2014. I sat in jail for about a week, but that did nothing. As soon as I got out, probably the day after, I was like, you know what, I just went right back to it. But then June 8th, 2014, I was arrested. It was a very bad day at the time, but it turned out to be one of the best things that could have ever happened to me. I was facing very, very serious legal issues. The guy I was with at the time had robbed a gas station, and I had no part in it. However, I was in the car and I knew about it, and I didn't tell on him, so I got in trouble for that, charged with aiding and abetting a felon, and party to a crime of manufacturing and delivering heroin. So I was facing a pretty good chunk of prison time. DA was asking for like 10 years, 5 in, 5 out. So that was a pretty big wake-up call. I knew something needed to change. But also, while I was in jail, I found out I was pregnant. So that was kind of just icing on the cake, I guess, that made me, you know, like I just couldn't keep living like that. It wasn't just me. I have someone else I have to think about now too. So that was a huge, huge motivation to seek help and find a way to get clean and stay clean. While I was in jail, I got in touch with my sponsor. When I was clean for those 6 months, I had gotten one, and we kind of fell out of touch when I was using, but she agreed to be my sponsor again and helped me get a hold of someone from the county who got me into treatment here at St. Agnes in August of 2014. The judge let me out to go to treatment, and I've been coming here ever since. I got involved in NA again, so I still attend that. And then in November 17th, 2014, I gave birth to a healthy baby girl. She helped save my life and continues to do so every day. Today, my legal issues have been resolved as best they can. I did have to serve jail time. However, after kind of in the middle of my sentencing, the DA just changed his mind after hearing my counselor and my family and a few other people talk. He agreed to give me a chance. So I only got 10 months in jail, and I have 5 years probation, which is awesome. He gave me a second chance, and I am very, very grateful for that. I have a job. I've had a job. Sorry. I've had a job for over a year now, which is like the longest I've been able to hold a job in a very long time, so I'm very grateful for that. I have awesome family. I couldn't do it without their help. Yeah, they're phenomenal. And yeah, my sponsor, so grateful for her too. And just healthy friends, surrounding myself with good people and good influences is so important. So I'm grateful to say I have 11 months, or 1 year and 11 months clean.
My name's Wendy, and I am a recovering alcoholic and a drug addict. For me, I grew up in an alcoholic home. My father was drunk all the time. It was really normal for me to see adults drinking and being brought up in that environment. He was a very angry drunk, and I remember a lot of my Sundays consisted of picking up fuzzies off of the ground because he didn't want to hear the vacuum running. My parents divorced when I was 9. I felt very isolated at this time. I had to move away from my friends, and this is kind of when I noticed I started to change a lot. My mother introduced me to her new boyfriend immediately, and he moved in with us right after my father moved out. And I really never felt comfortable, even in my own home, in my own skin. I just didn't feel like I belonged. I started drinking at 14. That kind of seemed to answer some of my problems. The first time I ever got drunk, I immediately had a high tolerance. I think I drank 6 or 7 beers the first time. It wasn't soon after that I tried marijuana and cocaine and started hanging around everybody that did the same thing. My friends did drugs and drank, and it just felt normal. I stopped caring about school, family, and friends. I was very rebellious at this age. I started running away from home. And by the age of 16, I was drinking every weekend, and I could drink about 8 to 10 beers at a time. At 17, I had to sit in jail from running away from truancies. This was kind of the first thoughts that maybe I have a problem. My mom came to court, and the judge was going to let me out, and she told them to keep me because I was such a handful. She didn't know what to do with me. I kind of straightened out for a little bit, and I got it together, and I graduated, and I found a job serving tables that I really liked. I enrolled in college at 18, but it only was after about 1.5 years that I dropped out because I was drinking all the time. I couldn't make it to school. At this point, I was drinking probably a 12-pack of beer, probably 5 to 6 nights a week. At the age of 22, my stepfather died, and this is when I was introduced to painkillers. Immediately when I tried painkillers, I was hooked. I didn't know that I was going to be hooked. I didn't take them with the intention of thinking this was going to be my new lifestyle. But it was the answer for me at that time. It numbed my pain. It took away any bad feelings I had. It made me feel good. And I didn't feel good at the time. So I lost my job soon after. I lost my apartment. I had to move home to my mom's house. It escalated really fast for me. I couldn't stop. That was all I thought about all the time. When I went to bed at night, I wondered how many drugs I had to make sure I'd be able to get up and function the next day all day long. My days were spent making phone calls and getting drugs and maneuvering to try to find drugs. It's exhausting. That lifestyle is exhausting. Nobody trusted me anymore. Everybody knew that I was on drugs. I went from boyfriend to boyfriend to support my habit. When I didn't have pills, I started to drink to avoid withdrawals. I tried to quit many times. I could never get past it. When I was sick, it was awful. I could get maybe 3 days of clean time, and the body aches and the muscle aches were so terrible I couldn't stay clean. But this time I was using 10 to 15 milligrams Percocet daily. I thought I was going to die. I didn't know how to get out of the cycle that I was in. I knew that I didn't want to live this way, and I knew I couldn't quit. So I was contemplating suicide. I came into St. Agnes on suicidal ideations. My boyfriend at the time brought me in. At this point, I totally surrendered. I knew I had a problem, and I was willing to do anything to get help. I would have eaten glass if someone told me it would relieve some of my symptoms. I started the Suboxone program shortly after, and within the first week of being on Suboxone, I felt changes. I could think clear thoughts again. The obsessive thinking was gone. I didn't sit around and think about drugs all day. I felt like myself again. I started therapy shortly after I came into St. Agnes, and I really got to the root of what some of my problems were. I learned how to work through emotional pain without needing to numb it with medication and alcohol. I really turned my life over to God and His care. In the first year of my recovery, I got married, I had a baby, and I started school. Sorry. I graduated from Marine Park with high honors in December of 2014 with my associate's degree and my SACIT for substance abuse counseling and training. I continued on, and I'll graduate from Viterbo at the end of this year with my bachelor's in substance abuse. This is my loving family and my awesome husband. They keep me sober too. I now have confidence in myself. I want to give back that's been given to me. I had great counselors. I believe that addiction is a disease, and if I do not manage it daily, it's going to get me, just like diabetes or anything. Life can change. Yesterday, I just found out that I got offered the job at Dodge County to be their alcohol treatment court coordinator. So, thank you.
Some time for questions. Okay. So if you have questions. Questions? Beck?
I'm sorry, I forgot your name for the second lady that talked. I'm sorry?
Are you talking to me?
Yeah, the second. You.
I'm Wendy.
You had said that you started your opioid addiction when your stepfather passed away. Was that something that they prescribed to you for that, or did you just start that on your own?
Yeah, I just started it from friends. I found it off the streets, and that's how I started my addiction.
Question. It might seem a little naive, but when I talk to people, the counselors who work here, and also individuals like yourself who have recovered, everybody's like, heroin's so easy to get. I wouldn't even know. I mean, people like me who are naive about this, so that I can be protected for my children and my grandchildren. What am I supposed to be looking for? I don't know how to get heroin. I know how to get alcohol, but I wouldn't know what store you go to about heroin.
I mean, I guess it's just the lifestyle you're involved with, the people you hang out with. I mean, I wouldn't know where to get it now. I mean, I guess like from my past I could go to the same person, but I don't have contact with those people. I don't associate with people who do it. So yeah, I guess you have to be associated with them to know where to get it, if that makes sense.
You could go to any high school party and get it. Truly.
I also think you need to be, there'll be big changes in the person that's using. There'll be a shell of the person that they used to be. Also, pupil dilation is a big indicator that someone's using. And really, loss of care and interest in old things is a big indicator.
Bill?
You both mentioned heroin was cheap. How much does it cost? What's the street value of that?
I guess it depends. Like, I personally used to pick up a gram of it for like around $100 versus getting not very many pills for that much.
So do you use that whole gram at one time then?
I would tell myself I'm going to save it and use it just a little bit every day, but yeah, it would be gone within the day if I had enough money to get it.
So you're saying every day you need $100 to get another gram?
Yeah, and I mean some days I wouldn't come up with the money. Some days I could only, you know, come up with $20 to get a little bit, so I wouldn't be sick. But if I had the money, even though I told myself over and over I'm not going to use it all, I just, like she said, you can't control it. It just, if it's in front of you, I would do it. I couldn't help it.
First of all, thank you very much for doing this, and that was very brave, and you both should be very proud, so good for you. My other question was, you both mentioned when I was sick. So is that what you're talking about, like Dr. Kirkwood was saying, your withdrawal symptoms? Mm-hmm. Okay. So to manage that, the nausea, the vomiting, the body aches.
It's like the worst flu of your life that you've ever had. And on top of it, then all your brain's thinking about is how to not feel this way anymore.
Wendy, I have a question for you. You said that you're going to be a counselor, a substance abuse counselor, and I don't know if you had mentioned how many years now you've been sober.
I didn't, yeah.
But are you continuing to also see a counselor for your?
I go to NA meetings. I stopped seeing my counselor. I've been clean now for 4.5 years. So I stopped seeing my counselor. I saw her for about almost 3 years, but I don't see her regularly anymore, but I still attend support groups.
This one's for Kelly. I'm Kelly's sponsor, Denise, but I wanted to know, you mentioned a lot about being in Narcotics Anonymous, and we had a really hard time getting Narcotics Anonymous into the jails. We try to a lot, getting them into the jails and prisons, and you had gone back to jail after having experience with Narcotics Anonymous, and how do you feel that although you had to go to jail, which people do have to go to jail after they get clean, how do you feel that that impacted other people while you were in jail?
Like just now, just when I went,
like about carrying the message.
Yeah. I guess I just tried to show them that there is hope. Because I mean, there's some people who just all they talk about is I can't wait to get out, I can't wait to get high. But then there's others who, are just they say I'm so sick of this. I don't want to have to do this anymore. So I would just try and I brought in I have a daily meditation book from NA just for today book. I brought that in, so I would just give that to people like, hey, you can read this if you want. Don't be afraid to grab it. And live by example, I guess, because actions can speak louder than words sometimes. And I did, once in a while people would be like, you're so nice, like how can you be in jail right now? And I'm just like, if you would have known me 2 years ago, you wouldn't be saying that. Like,
being clean changes your life, and there is hope, there really is.
Thank you.
Is there a shortage of doctors to treat patients right now, though? I mean, we had somebody come in and they wanted to seek treatment and they couldn't get in for like 6 months.
Yeah, there's definitely a shortage. For Suboxone, for example, for physicians to prescribe it, they have to take a special training course. It's actually a pretty easy course. It's 8 hours. It doesn't take a lot of time, but it's hard to find doctors that are willing to follow through and get that training and do that kind of work. So there definitely aren't enough doctors. And up until recently, Suboxone physicians could only prescribe to 100 patients at a time. So that's somewhat limiting also. But there's legislation, and it may have passed already, I don't know, but it's right on the verge where doctors will now be able to prescribe for 200 patients. And then the methadone, for someone to prescribe methadone, they have to be in a very specialized clinic. And we do have one in Fond du Lac now, and then there's one in Madison, Appleton, and Sheboygan. But again, that's a very specialized type of treatment, and not all physicians can do that type of work. So there definitely is a shortage.
I'm curious, in this region, what age is the typical age for starting to experiment with drugs and alcohol? Do you have an idea?
From what I've heard, it sounds like high school, even early high school. That's at least from what I hear from patients. I don't know data about it, but I would say definitely high school.
Is there a limit on the number of patients you can see, the 100 to 200?
You know, I don't know why they made that rule. I'm guessing they didn't want doctors to become just, I don't know. I'm not sure. I'm guessing there was concern that the privilege of doing that might have been abused in some way, like doctors would be prescribing to anyone and everyone without carefully considering whether it's appropriate for that patient. They also want to make sure patients get not just medication, but the counseling piece as well. You know, you hear about these like pill mills down in bigger cities where doctors are taking cash only to prescribe, you know, opiates to people where they don't even do an exam. And, you know, you hear about places like this. So I think they were trying to regulate it to make sure that people were getting appropriate treatment.
Can any provider prescribe that medication?
Yes, any physician. It doesn't have to be a psychiatrist or an addiction medicine physician. I think they might be looking at allowing like physician's assistants to do it or nurse practitioners, but I don't know that for sure. But any type of physician can prescribe Suboxone.
Can you prescribe that to adolescents?
I'm sorry?
Can Suboxone be prescribed to adolescents?
Yes, as far as I know.
Okay.
And is that like a lifetime, like how long do you take Suboxone or methadone?
It's very individual. I mean, when we start people on Suboxone, we kind of tell patients seem to do best if they stay on it at least a year or two, but the reality, at least in my practice, is people stay on it much longer than that. It's not easy to get off. I mean, if you try to get off Suboxone, the withdrawal is the same as opiate withdrawal. The difference is when people are on Suboxone, they just feel normal. They feel like their normal selves. They're able to go to work. They're able to do all the things that they normally do. They don't have to worry about feeling sick. I think I have 1 or 2 patients that have been on it for 7 years. You know, and if they require a medication so they can live their life normally and how they want to, as far as I'm concerned, they can stay on it as long as they need it. So it ends up being a more long-term medication than what we initially thought. Yeah.
If you had a child, would they be addicted to the Suboxone also?
Yes, during pregnancy, if the mother is on Suboxone, there's a possibility that the baby would have withdrawal after it's born. But I've had some patients whose babies have no withdrawal at all, and there's no problem. So it really kind of varies.
I'm one of them. My son Grady, the littlest guy right there, he is 6 months. We got pregnant on purpose, me and my husband. I'm on Suboxone, and he had no withdrawal. He's wonderful, good mood. He came home that day, the same day I came home. So for me, I had no problems.
Same with me. They put me on Suboxone when I found out I was pregnant in jail, and I continued it when I came here. And yeah, she was born just a healthy baby girl. She came home with me 3 days later, and we're good to go.
Yes.
I was just wondering, when you said that you were both using or whatever, and then when your parents find out about it, you know, they always say the tough love. Any comments on that? I mean, do you think that helped you in any way? Or if your parents wouldn't have stepped in, what might have been the consequences? I think a lot of people don't want to do that tough love. But do you think they need to no matter what?
In a sense, I mean, like I say, I have amazing parents, but they didn't push me away, but they wouldn't, like, if I wanted money, they wouldn't give me money. They did, I halfways lived at their house, but right before I got arrested, I guess they kind of were considering, like, kicking me out pretty soon, because, I don't know, and like they were the ones on the video, those are my parents, and as soon as I got arrested, they came, my mom came to see me in jail, and like, they were so loving and supportive. As soon as I said, you know, I want help or whatever, so I guess, yeah, because it's not good to enable them either to just hand them money and be like, oh, it's okay, because it's not. I don't know if that answers your question.
I think everybody just, you know, questions if that's the way that would really help somebody or just make it all the worse.
If someone doesn't want it, nothing you do is going to matter. My parents tried so hard. They truly did, but I wasn't ready. So, I mean, you could offer them the best treatment in the world, but it's not going to work unless they want. Unfortunately.
Thank you for your questions. Kelly, Wendy, thank you so much for sharing your story. And Dr. Kirkwood, thank you for sharing your expertise. Yes. Okay, we draw
you
for...
want to do the winner and we get noon?
Chris Nett. All right, thanks everyone for coming. We do have a session at noon, so if you enjoyed this morning, please spread the word, okay?